Hello student, welcome to the lecture on health financing, and after this lecture we will be able to learn the following objectives. Describe the concept of health financing, discuss the changing world of healthcare finance, analyze the changing world of health services finance, explain the private health insurance, describe the social health insurance. Let's start with the introduction. The World Health Organization (WHO) defines health financing as the function of a health system concerned with the mobilization, accumulation and allocation of money to cover the health needs of the people, individually and collectively in the health system. It states that the purpose of health financing is to make funding available as well as to set the right financial incentives to providers to ensure that all individuals have access to effective public health and personal health care. Health financing has three key functions and defined here: revenue collection, pooling of resources, and purchasing of health services. Revenue collection. It is concerned with the sources of revenue for healthcare, the type of payment or contribution mechanism, and the agents that collect these revenues. All funds for healthcare, excluding donor contributions, are collected in one way or another from the general population or certain subgroups. Pooling of resources. The second main aspect of health financing is the accumulation and management of funds from individuals or household pooled members in a way that ensures individuals contributors against the risk of having to pay the full cost of care out of pocket in the event of illness. Let us now know the concept of health financing. Health financing reforms are a core part of health sector development in low and middle income countries. The current focus of the international debate is on the need to move away from excessive reliance on out-of-pocket payment as a source of health financing towards a system which incorporates a greater element of risk pooling. Health financing in decentralized system. The level of decentralization of the general government or the public healthcare sector is an important factor that can influence the patterns of resource flows through the health system as well as key issues related to. For example, service provisions such as the allocation of resources across programs or budget categories and provider incentives for quality of services, the basic flow of government funds for the public healthcare sector under general government decentralization. Out-of-pocket and third-party payment. In a most basic way, healthcare financing represents a flow of funds from patient to healthcare providers in exchange for services. There are two ways of paying for health services: out-of-pocket payments. This is the simplest and earliest form of transaction between patient and provider. Access to care depends on ability to pay. Third-party payments, the uncertainty of needs and the great cost of healthcare need that people choose to finance health services through payments to a third party, an insurance company or a government. The changing world of healthcare finance. Let us now discuss another topic: private consultations with doctors. Over-the-counter OTC drugs, co-payments and user fees, where third-party payment is prevalent. Cost sharing in the form of co-payments plays an important role. Unofficial fees. Besides official fees, unofficial payments to health workers are common in many countries. Services not covered by insurance, transport costs, traditional or complementary medicine and luxury services such as cosmetic surgery.
Yesterday I was at the Indiana State Fair and I got to see the world's largest boar. He weighs more than 1,100 pounds and he can't stand up because his body is too big for his tiny little legs. And what, you ask, is the name of the world's largest boar? Walkin' Tall. Hank Walkin' Tall, the world's largest boar who can't walk, reminded me a little bit of America's healthcare system. Depending on your perspective, he's either impressively huge or distressingly huge. So what do you do when you have a pig that's so big he can't walk? You either kill him, put him on a diet, or keep feeding him, which is more or less what the healthcare debate boils down to. I want to talk in a nonpartisan way about the healthcare debate, but I don't want to talk about death panels because they're not in the bill, and the stupid, unsophisticated debate about them has distracted from a really large and significant issue. So here are two things that pretty much everyone, conservative or liberal, agrees upon. One, the United States spends way too much of its gross domestic product on healthcare. And two, our current healthcare system is radically unfair. Whether you have good healthcare in America is dependent largely on whether you work for a big company, because big companies have to provide health benefits, and second, whether you have a pre-existing condition, which a lot of times isn't your fault. Some people argue that we need a sort of large-scale government-run insurance company, the so-called public option, which everyone would be able to buy into, and poorer people would pay less than richer people. And then this huge government-run insurer would negotiate lower costs for procedures and also cut down on the number of procedures used. Now, even though the public option would not in any way eliminate private insurers still hate the public option because they know that the government-run insurance company will be larger and therefore more able to negotiate lower prices, which will in turn make the public insurance less expensive, which will make people less inclined to use private insurance. Then you have the people who want to put the pigs on a diet, who say that instead of a public option, we can create these sort of non-profit insurance companies that will then have to compete with private insurance. And because they won't be for-profit companies, they'll be incentivized not to work for the shareholders in the company, but instead to work for the patients they represent. Now, of course, the downside of the put the pig on the diet plan is that you still end up with tens of millions of people who have no health insurance whatsoever. And then there are the people who don't want a healthcare system overhaul. They want to keep feeding the pig. A lot of those people are happy with the current state of their healthcare, and to be frank, I think they probably don't want to pay for people who make stupid decisions. Here's the underlying problem. Even though a lot of people are screaming, I don't want socialism, no socialism, in America right now, we have a lot of socialism. We share the cost of schools and roads and the military. We also currently have socialized medicine. We just have an outrageously bloated and inefficient system of socialized medicine because there are hospitals in America where anyone can go and get treatment. That treatment may eventually bankrupt you, and it may be of poor quality, but you can get it. And I would argue that it's the inefficiency of our socialized medicine that in the end makes healthcare so much more expensive than it is anywhere else in the world. Is healthcare a privilege or is it a right? If it's a privilege, even if it's a really desirable privilege like indoor plumbing, we need to stop giving healthcare of any kind to uninsured people who can't pay for it in advance. I think the reason we continue to treat people who are uninsured is because we don't believe that healthcare is a privilege. We believe that it is a right. And if it is a right, like life, liberty, and the pursuit of happiness, it is the responsibility of a government to protect that right.
The evolution of health service finance international comparison shows that countries use different ways of paying for health services. For example, France and Sweden have developed distinctly different practices to fund hospitals and to pay for doctors. Latin American countries have social insurance system, whereas in many African countries, government funding is common. Two models of healthcare finance for achieving universal coverage. Two models that are often referred to in connection with attempts to ensure universal healthcare coverage are the Bismarck model, which is based on compulsory social health insurance, and the Beveridge model based on tax-funded services. Otto von Bismarck, 1850-98, Prosco-German statesman and founder of social insurance in Germany. Bismarck introduced in 1883 a plan based on compulsory insurance protecting workers against accident, sickness and invalidity. William Beveridge, 1879 to 1963, British economist and architect of the British welfare state. The Beveridge report proposed a tax-funded plan to provide full preventive and curative treatment to every citizen of the UK, leading to the foundation of the NHS in 1948. Developing methods to pay providers. Methods of paying healthcare providers have evolved along with the development of funding system. Finding the optimal means of providing payments has been a constant source of political debate. Strategies used by doctors to gain favorable conditions have included boycotts and takeovers, as well as the foundation of their own insurance organization. Let us now discuss another topic, the changing world of health services finance. The means of paying for healthcare is an issue of concern in most countries. Governments are worried about the economic and political consequences of the increasing cost of providing health services and try to limit spending through tighter controls. There is a large body of literature to suggest that many countries are dissatisfied with the existing methods of finance and delivery of health services. During the last decade, governments have introduced a series of reforms. Demographic factors. Someone needs to distinguish between absolute population growth and relative changes within a population towards groups with higher health care needs, the elderly, the very young, displaced population. Both mechanisms may influence healthcare cost. Economic factors. Economic growth is associated with rising costs for health services. Economic recession has opposite effects, but one needs to be aware that unemployment and poverty are related to ill health and put additional strain on health services. Health technology advances. At the beginning of the 28th century, health services had only a few effective treatments. Since then, the number of effective intervention has steadily expanded. For example, antibiotics, open heart surgery, hemodialysis, and computerized tomography disease patterns. Why does the change of disease patterns, which has been observed in many low-income countries, affect healthcare cost? First, new diseases like HIV or AIDS increase the level of ill health in the population. Second, the relative increase in chronic diseases and long-term illness is related to higher treatment cost. Political factors. Health budgets are inevitably based on the political judgment. There may be additional cash injections before elections or deviations from planned growth rates because of other priorities. Some popular fallacies of the current debate. Be cautious with estimates of the effect of aging on healthcare costs. Recent research has shown that the highest costs occur during the last year of life. 170 health financing irrespective of age. Very old people may even tend to consume fewer resources than younger ones. The public-private distinction. A common feature of all health systems is the distinction between public and private healthcare. This distinction refers to both the finance and the provision of health services. The concept of ownership is used to distinguish whether an organization belongs to the private or public sector. Public-private mix in finance and provision. The organization of financial intermediaries may be on a monopolistic, oligopolistic, or competitive basis. In a monopolistic system, the financial intermediary is usually a public agency such as a government, a quango, or a health corporation. Private health insurance. Though private insurance is of limited significance in most countries, it is important to study the methods which try to reduce the inefficiencies of this source of finance. The significance of private insurance. The USA is one of the few countries which depend on private insurance as a major funding mechanism for healthcare. The following extract by Donald Sund and Garrett raises the key concerns about private insurance. Private health care insurance. Moral hazard exists in private insurance-based healthcare system with a third party, that is the insurance company, paying healthcare bills on a full reimbursement basis and employers contributing heavily to premiums. Neither the consumer nor the provider has an incentive to be cost-conscious. These have two essential features. First, an individual or household specific account with balances earmarked for healthcare expenses, and second, a high deductible catastrophic insurance plan to cover expenses above the deductible. Regulation of private insurance market. Private insurance involves high transaction costs related to marketing, claims processing, handling of reimbursement, and fraud detection. In unregulated markets, administration costs plus profits may account for up to 35 to 45% of the premiums. Private insurance companies relate the personal premium to the actuarial risk of the individual. Under retrospective payment, neither consumer nor provider has incentives to contain costs. Various methods of cost sharing are used to discourage excess demand.
Healthcare today is a bit like a game. Sick patients seek treatment. We providers use our best technology and training, triggering lots of charges that insurance, whether private or government, doesn't want to pay. And if they're uninsured, patients can get stuck with unaffordable bills. How did we ever get into this mess? Not long ago, medicine was not as expensive, but it was also not very advanced. Over time, medical technology, lifespans, and the cost of good medical care all increased. As medical costs skyrocket, fewer people have adequate insurance and cannot afford their bills. Our new healthcare law ensures affordable coverage for all Americans and introduces a new model for paying physicians and hospitals. We are responding to these changes. But more importantly, we're forging a better organization that will remain strong and viable for the future, regardless of ongoing changes to healthcare legislation. In short, our healthcare system will be focusing on demonstrating value. In the future, insurance payers, whether private or government, will pay for the comprehensive treatment of a patient. But they will be keeping a close eye on patient satisfaction, quality outcomes, and how well we heal our patients and keep them from having to be readmitted. We have established a new governance structure to better manage patients, to better manage populations, to better manage our finances and resources, and to better manage the market. Most of all, however, we will continue to remember that patients have a choice in where they receive care, and we want that to be an easy choice in our favor.
Social health insurance. The viability of social health insurance as a means of mobilizing resources for the health sector and providing services efficiently and equitably. Principles of social insurance. Social health insurance is insurance operated by a public agency. Conventionally, the premium takes the form of compulsory contributions which are deducted from the payroll as part of earnings. The characteristics of social insurance system are compulsory membership, payroll deduction of contribution, run by public bodies, either single or multiple organization, redistribution policies, clearly defined earmark resources, complex administration, relatively high cost, can mobilize additional resources for the health sector.
Why we need government-run, universal, socialized, call it whatever you want, health insurance. Alright, so we all know from basic civics class and just being alive that a lot of essential services are already government-run, universal, socialized, whatever you want to call it. Think water treatment, police, fire, postal service, Coast Guard, all those things you know are going to be there for you every single day without even thinking about them. We all pay our taxes, and the government uses the money to pay for the things everyone needs just to get by. Now, healthcare is just as essential as any of these services. Sure, a few of us may be lucky enough to make it through our whole lives without some kind of medical problem, but the rest of us depend on healthcare at some point during our lives just to get by. Besides its essentialness, there's another reason health insurance is just like those other government-run, universal, socialized, whatever you want to call them services. That's this. Very, very, very few people can afford to pay, all on their own, the cost of healthcare when disaster strikes and they or someone they love gets really, really, really sick. So we all need insurance, which basically means we need to pool our money together enough so that when any one of us gets really, really, really sick, there's enough money in the pool to pay for that person to get better. That's insurance. But who should we choose to manage the pool of our money and dole out the money to the people who need it? Well, private insurance companies are the ones who do it right now. But there's a problem. On average, these companies take out 10 to 20 cents out of every dollar we put in the pool. Some of that 10 to 20 cents they spend on administrative costs, processing paperwork and paying for ads to get more people to sign up. But some they use for things that aren't even remotely connected to caring for people's health, like paying for political campaigns to fight against health insurance reform, for example. Of course, some of the money they just take out as pure profit. Who gets the profit? Investors, generally wealthier people who have money to invest. Now, insurance companies are ultimately responsible, accountable to their investors. The more profit the executives at insurance companies make, the bigger their bonuses. It turns out that one of the best ways of increasing profit is denying people coverage for their health problems. That's why insurance companies try to do this as much as they think they can get away with it. Which brings us to the biggest reason why we need government-run healthcare. Profit wouldn't be part of the equation. That means the government would spend more of our insurance pool on actually caring for people's health. Probably much more. The Medicare program, for example, a real live model of government-run health insurance, only takes 2 or 3 cents out of every dollar in the pool for administrative costs. They take 0 cents out for profit. That means more money goes to actually curing sick people. Some people seem to think that government health insurance could never be as efficient as private free market insurance. I'm not sure why they think so. The government certainly runs lots of other essential services really well: police, fire, water treatment, all those services I talked about before. Just imagine if instead of being public, government run, and free, you had to buy fire insurance like people buy health insurance today. First, you'd have to try to understand a 100-page fire insurance policy with lots of legal terms nobody but fire insurance lawyer specialists can understand. Then either you or your employer would have to pay the insurance company with money from your paycheck to join the plan. Then, of course, 10 to 20 cents out of every dollar you gave the company would go to administration and profit instead of hoses and other tools. And what if there were a fire? You'd have to call around and make sure you found a fire station that was in your insurance company's preferred provider network. Then the fire trucks would come and put out the fire, but wait, that's not the end of the story. It may turn out that the small print fire insurance legal language in your policy says that the particular type of fire in your house wasn't covered by your insurance plan. Or maybe you had a pre-existing fire burning in your backyard barbecue, so the insurance company won't pay the firemen. Now you owe the firemen hundreds of thousands of dollars. You'd mortgage your house to pay them back, but it's not worth much because it was so badly burned in the fire. It turns out that fire insurance is just fine the way it is. Free for everyone, paid for by our tax dollars with nobody skimming profit off the top. And that's the way health insurance should be too.
Redistribution is based on the notion of equity and seeks to transfer income or wealth from the rich to the poor. Social insurance is based on redistribution policies to equalize the financial burden of health care and to ensure access to care on the basis of need and not on ability to pay. The main difference between social and private insurance is the extent of the redistribution intention of the former. Social insurance aims at four means of cross-subsidization: from the healthy to the ill, contribution regardless of individual risk; from the young to the old, smaller contribution from the elderly; from the rich to the poor, contribution are a fixed percentage of earnings; from singles to families, equal contribution regardless of the number of dependents. Payroll deduction. Payroll deductions are a common way of raising contribution. Payroll contribution depend on formal labor. If the informal sector is relatively large, as is in the case in many low-income countries, social insurance may be impractical to implement. The desirability and feasibility of social insurance. It is necessary to identify the administrative needs of an insurance system and decide whether they can be met. Insurance arrangements tend to be more complex and often more expensive to administer than tax funding and certainly require considerable administrative skills. Payroll deduction. Social health insurance normally provided through a system of payroll contribution to a health fund. It is typically, although not essential, for the total contribution to be calculated as a percentage of income. This amount is normally split between employer and employee. For example, if the total social health insurance contribution for a worker is 12% of the wage, this may be made up by contribution of 8% from the employer and 4% from the employee. Labor market structure. Social insurance for health is funded by a percentage deductions from incomes or salaries, and this depends on there being an agreed measure of income. Social health insurance, therefore, works best in the context of a relatively large formal sector with a large proportion of the population working as employees, so that there is little scope for doubt about their incomes. Social health insurance and natural infrastructure. Social health insurance requires some additional administrative arrangement for collecting contributions and providing access to care, and it can only be developed if these arrangements can be put in place. The overall level of education within the country can be important in this respect. Adequate standards of literacy and numeracy in the general population may be important to the extent that self-assessment is an element in the determination of insurance contribution. Thus, education in general as well as the educational level of the administrative staff can be significant. Some countries have an established system for collecting income tax through payroll deduction. Under these conditions, it may be possible to introduce social health insurance contribution using the same basic procedure but paying the money into different funds. This can simplify the operation of social health insurance and reduce cost. Social health insurance and healthcare infrastructure. Health insurance gives the insured population an entitlement to health services. It is therefore important to ensure that the health infrastructure exists to provide those services and that there is some incentive to comply with insurance. It is important that an individual should have better access to care if he or she pays the contribution due and obtains insurance. This is true even if the insurance is compulsory, since it helps to ensure that contributions are paid. In principle, insurance does not require a system of hospital-based secondary and tertiary health services, although such provision is typically popular with the population and thus with the insured population. The important thing is to ensure that the health services to which insured people are entitled can be delivered. When social health insurance is introduced, it is often difficult to offer advantages to members in the form of better access to care. Now, in the end, let us summarize what we have learned in this lecture. The World Health Organization (WHO) defines health financing as a function of a health system concerned with the mobilization, accumulation and allocation of money to cover the health needs of the people, individually and collectively in the health system. Health services are typically the Ministry of Health (MOH), Social Security agencies, district health boards, insurance organization and individuals or household. The uncertainty of need and the great costs of health care mean that people choose to finance health services through payments to a third-party insurance company or a government. Economic growth is associated with rising costs for health services. Economic recession has an opposite effects. Health financing reforms are a core part of health sector development in low and middle income countries.